I want to thank Unitek Learning for providing me with the opportunity to participate in your conference today. Unitek Learning and your associated colleges offer educational opportunities to the nursing profession that are an important link to our healthcare system. Thank you. The pandemic of 1918-1919, commonly known as the Spanish flu pandemic, was the second largest pandemic in global history. No one knew what caused it. There were numerous guesses. No one could find the guilty bug, and no one could see it, and no one could name it. The study of virology had just begun to become a field of study. It turns out that the virus responsible for the Spanish flu was a variant of the H1N1 and was not precisely identified until 2005. By the end of the 1950s, scientists had recognized the influenza viruses as a somewhat mystifying, highly diverse group of viruses capable of infecting pigs, chickens, horses, cats, as well as human beings. But no one knew where these viruses lived in nature. 100 years after the Spanish flu pandemic, COVID pandemic hit the global community in 2019. It was another variant of the H1N1 virus, a coronavirus. It was late 2019 that an influenza-like illness was first reported to the World Health Organization from Wuhan, China. By January 30th, 2020, the World Health Organization declared the COVID outbreak a global health emergency, and by March 11th, declared it to be a pandemic. The World Health Organization's first such designation since declaring the swine flu outbreak a pandemic in 2009. The first death from the pandemic was reported on January 9, 2020, in the city of Wuhan, China. A Chinese scientific researcher revealed a draft genome of the virus on January 10, 2020. This was a very important moment in global public health. This information allowed the international scientific community to begin work on how to create testing protocols, treat the outbreak, and to develop a vaccine. A vaccine was developed in a record time of approximately 9 months. Globally, it has now recorded 130 million infections and over 3 million deaths. The United States reported 32 million infections and over 565,000 deaths. The US death rate of 9,000 per 100,000 population is by far the highest death rate percentage globally. The United States represents 4% of the world's population, but we have recorded 20% of the world's deaths. The good news is that 216 million individuals have received at least one vaccination injection, and over 86 million have been fully vaccinated. And why did COVID have such a devastating impact on the United States? A lack of leadership at the federal level, coupled with the overall poor health conditions of Americans. When you look at the health comorbidities of Americans, such as obesity, heart disease, and diabetes, we do not rank well. From 2000 to 2018, obesity increased from 30% to 42%, and at the same time, severe obesity increased from 5% to 10%. Individuals with these health comorbidities and low wealth minority communities were impacted more heavily than the general population. It took some time to determine the actual origin of the virus. There were speculations of a laboratory accident in the city of Wuhan, but the World Health Organization later documented that it was a transmission from a bat in a public marketplace and not a laboratory accident. Bats and other wildlife animals are routinely sold for food in these Chinese public marketplaces. David Quammen, in his best-selling 2012 book, Spillover, documents how animal infections are transmitted to humans and how they initiate human pandemics. The impact of COVID has been devastating to our healthcare delivery system. Many of our healthcare providers are delaying retirement just to meet the demands of providing care during the pandemic. Hospitals have lured physicians and nurses to come back out of retirement, recruited current students and new graduates yet to receive their licenses to help ease the critical shortage of providers. Prior to the COVID pandemic, America faced a serious healthcare crisis, a severe shortage of healthcare providers. There are a number of factors that contribute to this healthcare workforce shortage. America is not alone. Most of the world faces shortages of healthcare professionals, a problem that will only worsen over the next decade. Baby boomers, including the 76 million Americans born after the Second World War, between the years of 1946 and 1964, are aging. The oldest baby boomer turned 70 in 2019, and over the next 20 years, most of them will face medical issues that require more extensive health care from a system that is overburdened by too many patients and too few healthcare professionals. Healthcare professionals are in extremely high demand, and it is unlikely to lessen for many years. With the face of healthcare changing so rapidly, there is an associated shift in responsibility, with nurses shouldering more of the burden. It is foreseeable that registered nurses could wind up being in as much demand as physicians and able to command far higher compensation than ever before. In a 2018 study from the American Association of Medical Colleges, it was reported that nearly 5 out of 10 American physicians are over 55 years of age. This, coupled with a trend of physicians specializing in specific areas of medicine, many older practicing physicians in family practice, general surgery, and internal medicine are retiring. The result is that half of the physicians that treat our aging population are retiring from practice. Physicians are not the only members of the medical team being affected in the health delivery system. The problem extends to the nursing profession as well. The Health Resource and Service Administration projects that more than 1 million registered nurses will reach retirement age within the next 15 years. With these projected shortages of healthcare providers and the impact of current pandemic, the lack of access to healthcare becomes very critical. Based on demand and growth predictions, the national shortage of nurse professionals will hit the home healthcare sector more acutely than any other healthcare sector. The current shortage of the impending crisis will present over the next 10 to 15 years, when the demand will far exceed the supply of nurse professionals. Coupled with America's aging population demographic, the shortage of healthcare nursing is widespread, with rural areas of the country being mostly affected. One area that is severely impacted is the area of complex pediatric patients. The shortage of nursing personnel typically leads to a longer stay in hospitals for the medically complex child. It has been reported that the average child scheduled to go home will spend an additional 54 days in the hospital due to the shortage of nurses that provide care after discharge. In a cost study by Dr. Ray Maynard, medical director at Pediatric Home Services, he states that delayed discharge resulted in an additional cost of approximately $170,000 per patient and an overall increased cost of $5 million to the health system in the state of Minnesota alone. In a 2018 study published in the Journal of Hospice and palliative care nursing, researchers found that nursing shortages are mostly based on how they impact the hospital setting rather than the impact on parents and families. In fact, the impact on parents and families is enormous. Family members, on average, provide nearly 74 hours per week of nursing care for their ill children. And when we look at the impact on the elderly population, the lack of home nursing has an adverse impact on these individuals as well. In a study reported in the American Association of Medical Colleges, it was projected a major shortage of primary care nurse providers by the year 2030. And California will face the highest nursing shortages by 2030, with nearly 45,000 nurses needed to meet the demand. Nationally, the number of nurses needed to meet the demand will be 388,000. All this is happening with less than 10 years from today. To compound this problem, there is a lack of educational opportunities for students wishing to pursue a career in nursing. The American Association of Colleges of Nursing reported in 2018 that an excess of 75,000 applicants were denied a nursing education. The primary reason cited in the report was a shortage of nursing faculty in educational programs. It is not uncommon for students seeking a nursing education in the nation's community college system to be waitlisted for up to 2 years. Access to healthcare and addressing health disparities have long been a problem, not only in the rural regions of America, but also in the urban areas of our country. The Affordable Care Act, enacted in 2009, was intended to address the health disparities and improve access to care for all Americans. California's plan, known as Covered California, successfully reduced our state's uninsured population to approximately 5%. One of the goals of the ACA was to connect our residents to primary care teams, but with the shortage of primary health care teams, patients continued to seek their care in the hospital emergency room. Hospital emergency rooms are not the most efficient place to receive routine care. They are the most expensive place to receive that care. The intended goal of the ACA was admirable, but there were implementation problems because of the severe shortage of the healthcare team to provide that necessary care. Additionally, the United States was not prepared for the COVID pandemic. Why? Our public health infrastructure was inadequately funded and our public health care system became overwhelmed. We did not have enough physicians, nurses, ICU space, personal protective equipment, respirators, and therapeutics to provide proper care. Over the past 2 decades, we have had a number of pandemics. Globally and nationally, our health delivery system was simply not prepared. With our current pandemic, the public has begun to appreciate the importance of scientific developments. The remarkable developments of a vaccine and medical school applications have actually increased by 17% over the previous year. Perhaps we're beginning to turn the corner, and there is a greater interest in healthcare because of the impact of the current pandemic. It is important that we begin preparing for the next public health crisis, the next pandemic, and the most important change that is needed is to increase the number of healthcare providers, especially nurses. What strategies we develop to protect our healthcare in the future? I offer 5 strategies for consideration. Place a greater emphasis on public health programs, make a priority of reducing obesity and addressing other health disparities, and the goal should be to improve our nation's health awareness. Increase the number of health care professionals, including physicians, nurses, and home health care professionals, by developing new models for educational scholarships, increase more public-private partnerships for increasing these scholarships, increase more private educational opportunities. For example, healthcare plans Kaiser Permanente and Prime Healthcare have established medical schools to help meet the demand, and provide tax incentives for healthcare providers to locate in underserved areas. Increase funding opportunities for educating healthcare faculty. Expose undergraduate nurses and advanced practice nursing students to community-based care. And finally, increase practice authority for advanced practice registered nurses and nurse practitioners, and allow nurse practitioners to sign home health orders. Now is the time to prepare. We don't have time to wait. Thank you.